Today is Friday, May 15th, and this is VOA's International Edition. I'm Lori Lundin in Washington. Coming up, a U.S. scientist who spoke out against the Trump administration's COVID-19 response tells Congress without a fast and improved response, the country will be in for a deadlier and prolonged crisis.
There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history.
Worrisome reports for the U.S. and global economies.
This is frankly another sickening punch to the gut, and unfortunately, we need to be braced for more incoming body blows along these lines.
Also ahead, a long list of big-name musicians will be gathering for an all-day online fundraiser next week. It's all on today's International Edition. A government scientist who says he was ousted from a high-level post after warning the Trump administration to prepare for the pandemic says the nation needs to do much more to avoid what he says is, quote, the darkest winter in modern history. AP correspondent Sagar Magani reports.
Appearing before a House panel, Dr. Rick Bright says his early virus preparedness concerns were dismissed. Among other things, he's worried about efforts to develop a vaccine.
We need to have a strategy and plan in place now to make sure that we can not only fill that vaccine, make it, distribute it, but administer it in a fair and equitable plan.
The White House has set up Operation Warp Speed to do that, and President Trump is disputing Bright's belief that it'll take longer than a year and a half to develop a vaccine.
I think we're going to have a vaccine by the end of the year, and I think distribution will take place almost simultaneously.
He's calling Bright an angry and disgruntled employee. Sagar Magani, Washington.
Meanwhile, the economic impacts of the pandemic cannot be understated. AP correspondent Shelley Adler reports.
Nearly 3 million laid-off workers applied for U.S. unemployment benefits last week as the viral outbreak led more companies to slash jobs, even though most states have begun to let some businesses reopen under certain restrictions. Another week and another grim unemployment report.
This is frankly another sickening punch to the gut, and unfortunately, we need to be braced for more incoming body blows along these lines.
Mark Hamrick, senior economic analyst with Bankrate.com.
We're well above 30 million total new claims for unemployment benefits. We know that the unemployment rate was elevated in the month of April, and there's no relief on that front either.
And the solution remains the same.
We need a vaccine. We need the vaccine deployed. We need to have effective treatment.
I'm Shelley Adler.
The ongoing wave of layoffs has heightened concerns that more government aid is needed to sustain the economy through this recession. Without another rescue package, many economists worry that thousands of small businesses will go bankrupt, leaving millions of unemployed with no business to return to. U.S. Senate Majority Leader Mitch McConnell said a $3 trillion bill proposed by the Democratic-led House of Representatives that provides aid to states and essential workers is totally unserious. And he didn't promise there would be another aid bill.
We're going to insist on doing narrowly targeted legislation, if and when we do legislate again, and we may well, that addresses the problems, the needs, and not the aspirations of the Democratic majority in the House.
But House Speaker Nancy Pelosi in a news conference Thursday said that by not taking the relief bill seriously, the Senate Majority Leader is showing a lot of tolerance for, quote, the pain of others.
He wants us to just pause. He wants us to just pause. But families know that hunger doesn't take a pause. Not having a job doesn't take a pause. Not being able to pay the rent doesn't take a pause.
U.S. Federal Reserve Chair Jerome Powell this week stressed his belief that Congress should consider providing additional rescue money to avoid prolonging an economic catastrophe. The United Nations is calling for mental health care to be given to millions of people suffering psychological distress from fear, loneliness, economic upheaval, and any abuse triggered by the COVID-19 pandemic. A UN policy brief, COVID-19 and the Need for Action on Mental Health, issued by UN Secretary General Antonio Guterres, explores the issues brought on by the crisis and offers recommendations. Lisa Schlein reports for VOA from Geneva.
National surveys carried out this year reveal widespread prevalence of distress in populations, with levels as high as 35% in China, 60% in Iran, and 45% in the United States. Similar studies among healthcare workers find anxiety levels have risen an average of 45% in countries such as Canada, China, and Pakistan. Devora Kestel is director of the World Health Organization's Department of Mental Health and Substance Abuse. She says measures must be taken now to protect and promote care for such existing conditions.
This is something that needs to be done in the middle of the crisis so that we can prevent things to become worse in the near future. We are all witnessing in every country of the world the risk of an economic turmoil that will affect people.
Kestel says mental health problems have surged during similar economic crises in the past, leading to high rates of suicide. One of the major recommendations in the UN Secretary General's policy brief is to ensure mental health and psychosocial support are widely available in any emergency. What may be feasible in rich countries may not be possible in the developing world. For example, WHO notes 1 in 5 people in South Sudan has a mental health condition, with only one professional available for every 4 million people. Kestel tells VOA that the WHO and other agencies have been working for years to strengthen the capacity of non-mental health professionals to provide care.
We are promoting the modalities where the community, some community leaders or sectors within the community, such as traditional healers in some contexts, could receive the basic knowledge and training that is needed in order to provide care to those in need.
The United Nations says psychological trauma will remain after COVID-19. The disease caused by the coronavirus is gone. It urges nations to reform, strengthen, and invest more money in their mental health care systems. It says these services will be needed to support societies as they recover from the terrible consequences of this life-changing event. Lisa Schlein for VOA News, Geneva.
Coping with the COVID-19 pandemic has been a personal trial for almost everyone in the world, but from a professional point of view, health and hospital workers are facing some of the most difficult challenges. The response against COVID has also meant heroic efforts by many workers behind the scenes as they procure equipment and supplies and organizing personnel. For the next part of our ongoing series of interviews with those on the front line, VOA's Adam Phillips spoke with veteran nurse Christina Masvidal, now the Senior Director of Patient Safety and Risk Management for Jackson Health Systems in Miami, Florida.
So we are always quite busy, like you just said. But when COVID came into the picture, it was kind of like watching a hurricane that was out in the ocean and you were waiting for it to hit your city. And we were doing as much as we possibly could to prepare and anticipate based on what we heard internationally, which wasn't such great information, right? And you're trusting an outside source. We had to break down every process that we normally anticipate and are trained for, but step it up exponentially, understanding that this virus was very, very lethal.
What did that involve specifically?
So anything associated with corona, from preparing our staff, ensuring that they felt comfortable to take care of these patients, to gathering our protective eye and body gear, to making sure that we had enough rooms that could possibly anticipate the number of patients we would receive during this pandemic.
That meant a lot more equipment too.
Right. We had to make sure we had the ventilators. We had to make sure that we had enough staff trained on those ventilators, that we had enough ICU nurses, and that we could actually reorganize the other staff for elective surgeries and put them in other parts of the hospital to kind of decompress the stress on the staff. You really felt like I'm just doing the best I possibly can for a storm that I really never was trained to deal with. We dealt with tuberculosis and other infections that come in internationally, but this was impacting different ages, different demographics, and it was having such an impact on the immune system that we did not know our normal practices would even work.
This wasn't just a clinical crisis, it was also a personal crisis for many of your colleagues.
Right. This one was more isolating. We really couldn't go back to our families. We needed to protect our families. And understanding that you are the front line, we are grateful to have our jobs. But again, I believe some staff would actually have hoped that they wouldn't be required to be that frontline healthcare provider.
So it's also your job to attend to the fear and the burnout among the staff.
Absolutely. That was something I also made sure we brought into play. And we created a on-call beeper that literally staff could page in real time to receive therapy if needed. And our teams have been using it. As a nurse or any healthcare provider, you just feel this overwhelming grief that everyone's experiencing, all these people that have died, not even having family at their side, and the funerals that are not occurring. And any patient right now who's dying does not have a loved one at their side. So as a nurse, that's an additional stress.
Here are some of the other stories we're following at VOA. Virtual reality tours have replaced flag-waving rallies as Palestinians facing coronavirus restrictions create digital spaces to lament the loss of their physical homeland in 1948. Cell phone apps and Zoom video chats are among the other online tools Palestinians are using to mark the Nakba, or catastrophe, when they and their descendants were forced from their villages or fled in the war that surrounded Israel's creation. Prime Minister Boris Johnson's top team of ministers agreed on Thursday that Britain will not give up its rights as an independent state by bending to the demands of the European Union in its talks on a future relationship. At a cabinet meeting, Johnson's team was updated on the talks by negotiator David Frost, who told them that Britain was not asking for anything special, bespoke, or unique in the talks, just a free trade agreement. And accused criminals across the U.S. have started using the threat of deadly COVID-19 infection as a weapon in attacks on police, retail clerks, and grocers trying to keep the nation fed during lockdown. Threats of spreading COVID-19 have occurred from coast to coast, raising questions about whether states will move to criminalize the weaponization of the novel coronavirus, the way more than half of U.S. states made undisclosed HIV exposure a crime when the AIDS crisis erupted in the 1980s. Stay with VOA for all the latest U.S. and world news.